We are on.
Hello,
Sorry
hello,
about that.
everybody.
Woo, a little bit of scare right there, Charlie.
Yeah, a little bit of scare.
I'm gonna let me turn my volume down here. All right, guys. Little bit of scare. We had a little bit of problem logging in. I thought we got bit by the Facebook bug again, but nope, it's all working good. We are live on Facebook, Twitter, YouTube, and LinkedIn. Aloha, everybody. We usually get on. That's why we go on early, guys. That's why Charlie and I comes on at 6:45 so we can make sure everything works. And all it took was a reboot of the system, and it's working. So thank you for joining us tonight. Hope you guys having a great day. What's up, Charles?
Well, as always, the expectation never lets us down. It's an anticipation of what the numbers are, what it will be. And I have to give a shout out to our good friend, Dr. Lee Altenberg. Yes, Dr. Lee Altenberg. Uh, he did his numbers. I also want to give a shout out to Mr. Brian Ingalls. These two love to crunch numbers, and they do it very methodically and very scientifically. Of course, uh, Dr. Altenberg does his theoretical modeling of what's to come, just using the numbers that we had already. And by golly, he hit it right on the teeny popo. So it was pretty interesting. Pretty interesting.
Yeah, and what's scary is his predictions went all the way up to a point where we're gonna get over 2,000 a day, and that was basically if then assessment. So it's not a projection, but if things don't change, then we can expect some very high case counts. And I got to tell you, he's right on the money. And we're gonna have him on next week. We're not gonna have him on this week. We're gonna have him on next week. We're trying to get Dr. Chiba from UH as well, from the Mathematics Center. And these guys, as Dr. Chiba said on the news, she said, mathematics doesn't have a political agenda. It's the numbers, it's the trends, the formulas, and I got to tell you, man, they're quite impressive. But I put this up earlier because I know we put up the numbers last night or the other night for Kauai's cases. This is just from today. 8 cases, 5 travel related, 63%. So I just put this up because I'm getting really sick and tired of hearing this 2% number. I'm really getting sick and tired with our leaders. I heard it today from our governor and from the Senate committee speakers that went up to the Senate committee hearing this afternoon. I got to tell you, I'm getting very irritated because they have conveniently ignored the fact that we have an issue with travel-related cases. I didn't say tourist-related, I said travel-related. So anyway, I just wanted to put that up just for you guys to chew on. 63% today on Kauai, travel-related. What, are we different than Oahu and Maui and Hawaii Island? I don't think so. So anyway, tonight, Daniel Ross from the Hawaii Nurses Association. I'm going to bring him in right now. And for those of you that were not on our show with Mr. Ross a week ago, please, come on.
There he is.
There we go. Oh my God. Oh my Lord. My heart had stopped.
Hey, I'm upside down. Here we
go. Yeah, it's okay. We can adjust. We can adjust.
There we go.
All right. Thank you. Thank you, sir. You like to be called Daniel or Dan?
Either way, Dan is fine.
Okay, I like Dan. All right, Dan. For those of you that don't know Daniel Ross, aka Dan, he is the president of the Hawaii Nurses Association. He is the one that oversees the nursing union. He's the one that oversees what's happening. We had him on last week. For those of you that were not here, Dan, accept my apologies for what happened. It was probably one of our best shows we've had. The emotions, the facts, the data, just it hit home for many of us, and we appreciate you. Unfortunately, for those of you that don't know, someone filed a complaint with Facebook and claimed that we spammed them, that our Facebook Live for that night was spam, and Facebook deleted the video completely. I cannot get access to it anymore. It is poof. And that caused us to now broadcast live on Facebook, Twitter, YouTube, and LinkedIn. So right now, Dan, we are wide across all platforms. So if Facebook wants to knock us off, guys, if we get interrupted tonight, go to YouTube, and you can watch the show on YouTube or Twitter or LinkedIn. So I just needed to get that out of the way. You know, Charlie, I'm Mel. Dan, welcome back. Things have changed significantly since we spoke last. I think everything that you were concerned about is coming to fruition. So, you know, I'm not here to duplicate what we did last week. This is a new show. What's going on, my friend? We saw the numbers today, guys.
They're pretty high. I'm just shocked that they called that spam. That's interesting. But the numbers are high. Not to duplicate what we talked about last week, but the nurses are burnt out. We are short-staffed. We've been short-staffed. That is our biggest issue. The COVID units are spreading. So as of today, the number within Queens, which is where primarily most COVID patients end up at Queens, they do get spread out somewhat. But at Punch Bowl, it's in the 50s. Based on the positivity counts, Queens is predicting that it'll be in the 100s next week. And that's when we peaked in the low 100s last time around. So they're preparing for it to be worse this time, for it to be a bigger impact. And they are converting more units into COVID units. My unit is supposed to convert to a COVID unit tomorrow. But I was talking to managers today, and there's some logistics that it might be a day or two. It all depends, because the hospital is so full. In order to convert the unit, they have to have empty beds, and we don't have empty beds. The hospital is over full. So that's where it's going on with the actual care for the COVID. And as I was telling you last week, we're in this staffing crisis. Definitely Queens and definitely Straub are experiencing a staffing crisis. Not enough nurses. They're begging us to work overtime. Nurses are working double shifts back to back in the COVID units. And what I expressed to you last time was, you know, that I was actually angry because very much predictable and very preventable staffing shortage, right? They've been short staffing us for years. We've been telling them. We saw it when COVID hit before, first time it hit, and they haven't done anything about it as far as hiring up. So they say they are now. They got positions posted, but there's lots to it. There's more than just posting positions. You have to incentivize people to actually fill those positions, right? We need experienced nurses. So why would an experienced nurse come here to work when, with our cost of living, your spending power of your earnings is lowest in the nation? So you can work anywhere else in the nation as an RN and have a higher standard of living than you can here in Honolulu or anywhere in the state. So that was what we're pushing on management is, look, you got to compete with the rest of the nation to get qualified nurses here and to get them to stay here. The nurses that stay here because it's our community, right? I can go to the mainland and have a nicer house, have a nicer car, you know, live a higher standard, but this is our home. Nurses are feeling burnt out on the nursing units, and not just in the COVID units, it's all over. We're just been understaffed and working too much. They're asking people to work overtime all the time. You know, with Straub, they've been hurting for a while since COVID started dying down. All their other things started picking back up, and they did not staff them accordingly. I've got a stack of testimonials from the nurses that they presented to their management, basically begging for help, saying this is unsafe. You've got to staff better. So that's why I'm angry about where management has mishandled it. You know, I said it a year and a half ago on an interview. It's like we feel we were failed by our nation. That was when we didn't have the PPEs, so our government did not provide. We were failed by our managers, by our our employers, because they had not provided. Back then it was the PPE shortage. Thank God we have PPE this time around, but we're failed again because they haven't provided the staff. We don't have the experienced staff. Now they have, so HIEMA has arranged through FEMA to get 500, I'm told 500 nurses. They come in a few weeks. Well, that's great in a few weeks, but in the meantime, we suck wind, and we have to make do, right? And Queens is also on their own, and I believe HPH to some degree is also bringing in travelers on their own, but that takes time too to get them over here, and in the meantime, they're not here. And all of those are stopgap measures, right? That's not a long-term solution. We saw this problem a year and a half ago, and that was time. If they had put in place things to address it long-term, we wouldn't be dealing with this now. Maybe we would have, because of the COVID surge, some extra need for extra, but not what we're going through now. Even before this surge, we were shorthanded. So that's where my anger at the poor management decisions is. We've got lots of other issues now. The vaccine mandate is a huge issue. It has a lot of our members very concerned and very upset. I support the vaccines, and the majority of our members support vaccines, and I urge everybody to get vaccinated. However, I don't think it's my place to tell anybody else that they have to get vaccinated if you're taking the proper, wearing your mask and your N95s and that sort of thing. So we have nurses that have worked in the COVID units for a year and a half who are like, wait a minute, I did all this and now I'm getting forced to do something that I don't believe in. It rubs wrong. And I get it. There's limited things that we can do. So we put in demands to bargain with both HPH and Queens at our two largest employers. And what we want to bargain is the exemptions and accommodations. What if someone can't get the vaccine? What is the definition of can't get the vaccine by them, so that we don't want to see anybody fired. They worked taking care of COVID patients for a year, then they're going to turn around and get fired. So we don't want to see that happen at all. We want to see what can we do for accommodations for them. And so one of the main things is regular testing, which is something we've advocated from the very beginning, that we should all be tested regularly. And I personally, it's no fun. I've been tested probably close to a dozen times since it's begun, and it's not a pleasant experience, but I think it's worthwhile. And I think all healthcare workers should probably get regularly tested, whether you're vaccinated or not, because you can still be a carrier. You can still contract it, and you can still transmit it, even if you're vaccinated, right? It's just the chances are less likely that you'll catch it. And if you do get it, it's more likely to be less severe, right? Be a lot better, but you could still pass it on to others who are vulnerable. So we still need to wear our masks. I'm concerned we're opening the schools up still, right? I haven't heard anything different. Have they announced that they're not going to open the elementary schools? I haven't heard that. I'm like,
nice, open. It's open.
Yeah, it's like, wait, and those kids can't get vaccinated. So that's Dan, very concerning to me.
Dan, I want to go back real quick.
Sure.
A week or two, actually about 2 weeks ago, right? We were being told every day by our state leadership that we don't have to worry about the hospitals. They're in good shape, lots of room for expansion. And we've known that it's not a matter of beds. And you made it very clear at the last time you were here that it's the personnel, it's the staffing. We're not just talking nurses, it's respiratory therapists and everyone else that is part of this hospital system. You came on the show last week and you talked about the management's failure to hire, that in fact, this need was known for a long time, and yet they just didn't hire. A very emotional plea that you made, yeah. And I think you struck all of us. And the very next day, Queens came out and said, we're requesting some assistance from FEMA for 140 nurses or whatever it was. What was that? What triggered that? Was it, was somebody watching the show? It just seemed kind of ironic that that happened the very next day. And all of a sudden,
I mean, yeah, you never know. I think it's always, in all these things, it's a combination. It's not one thing. It's not, I mean, I look at my role from the beginning of this is trying to draw attention to issues so that they get addressed, right? That's a lot of what I can do. And so that's why I thank you guys for giving me the platform that I say it to the news. I get interviewed by the news, and most of what I say ends up cut out. And the message that gets on the news are the sound bites, the story that they want to say, not the story that necessarily I want to say, right? So it gets twisted. So that's where I like to have it live ones, because they can cut you off short, but they can't. It's more difficult for them to edit you. They've got that 2-minute stop, but you've got to be really, really going off for them to use that pause, right? So I wouldn't take credit for that. Queens, we had been talking to Queens directly about it for a while, and since so at Queens, there was a big mess up in that right before this surge started happening. There was a bunch of travel nurses. So they travel out here and they have contracts to work for a period of time. Usually it's 4 months, 3-4 months, something like that. And they had a bunch expiring that week before that surge hit in the COVID units. They did not have any replacement for when they were gone. They had no alternative, not, okay, they're going to go and we're going to bring this in instead. They had nothing set like that. The staff on those units told me that those travel nurses wanted to extend their contract and stay longer. Management said, no, we're trying to get down the number of travelers to bring it down, which in itself is fine. We want to have regular hires, but if you don't have them, do it, and we saw that happening right before the surge really hit. And the surge is very predictable because we saw it happen in mainland first. It's the Delta variant, you heard all the news about it. It was, you wouldn't guarantee that it was going to hit then, but it not unlikely, right? Pretty predictable thing that would be happening. Plus it was like 3-4 weeks after 4th of July when there was a lot of people mixing and commingling. And, for the last couple of months, they've lifted these restrictions, and there's been a lot of people, everybody's tired of it. I don't blame them. They're tired of it, right? Everybody's sick of wearing the masks all the time and taking these precautions. But it's still important. It really is. We're seeing it now. And the people that are being hospitalized now are younger. They're primarily in their 30s, 40s, even 20s. There have been children hospitalized for COVID this time around. So it's striking younger people. Why that is, whether it's because the variant or, the most vulnerable were the elderly, and they pretty much all got vaccinated, right? The majority of Kupuno were vaccinated. So who's left to get it? You can still get it after you're vaccinated, but it's much less likely, right? So I don't know. I'd say it was a combination of things. Hopefully my speaking out and using your forum as one of the places to speak out does help to foment change. That's why I do it. That's why I speak out. In a year and a half ago, one things I often said was I felt like I was shouting in the wind because I was calling out all over the place about where are the PPE? Why aren't they doing it? Back then, the hospitals were refusing to test us. Nurses were begging to be tested because they were being exposed. And it's like, no, you don't need it. They were making us reuse the surgical masks, not even just the N95s, all sorts of just ridiculous things. And so I was shouting it out. I was saying it every chance I got. And I think it had a small part, at least, in getting it to shift, and it changed. We had Queens changed their policy 180 degrees, quite halfway through there. Queens went completely the other way, and it's like all the nurses could get all the PPE they needed. If you felt you wanted an N95, you could use one. Our whole thing then was why are we using them? If you want to say that, in case there's a shortage later, okay, save the used ones. And if you got no more new ones, those are there as a backup, right? But if there's new ones available, you should be using those. They're designed for single patient use, single use. So.
Any questions, Charlie?
Yeah.
Dan, I don't know if you're watching the feed. I don't know if you have a Facebook on a separate device, but I just want to say that we do have some nurses on. We do have friends and family of nurses. And I just want to say that they appreciate what you're doing. And they're also posting that whether it's themselves or their friends or relatives that are nurses, that they are getting burned out. That is definitely not in dispute. Charlie?
Yeah, I wanted to ask Dan, being head of a union, I just saw a union leader tonight kind of, I don't know what to have thought about the message from HGAA because of they're trying to mandate the mandatory vaccination. What's your feeling? I mean, you work in the healthcare industry, you have firsthand knowledge what vaccination can do.
It's honestly, it's a bit of a moral dilemma for me personally, because I strongly believe in the vaccines and I strongly encourage everyone to do it. But I also have the moray that I shouldn't be dictating those sorts of decisions to other people. So for me, it's a personal dilemma. As far as as union president, it's the policy of the union that we're going to support all our members. And we've got people on both sides of the fence. We have members who are adamant, if you're not vaccinated, you shouldn't be working in the hospital like that. And then we have nurses who have been working in the COVID units for a year and a half who are not vaccinated and for their own personal reasons don't want to get vaccinated and are potentially going to lose their jobs in a month or two because of this. So it's a moral dilemma for me personally to deal with, because I can't tell you how strongly I believe that it's the right thing to do to get vaccinated. That is my personal belief, but I also believe in not imposing my personal beliefs on others. So, and I get it when it comes to community health, that's a balancing act. And it's a tough one. And so that's where our policy is. We encourage the vaccines. We are opposed to mandatory vaccines. We recognize that in the private sector, now HGA is public sector, so it's a different rules that they go by. So I'm not very familiar with what Randy Pereira was saying. I saw him for a minute on the news. But for us, when they first started developing the vaccines, we went and talked to our attorneys and said, give us the opinion. What do you think is, what is the outcome of this? And our attorneys said, in their opinion, employers have it's management's rights. They can make it a mandatory, or not a mandatory, but a condition of employment. So they can make that, not that you have to get a vaccine, but if you want to work here, you have to have a vaccine. It's not a protected class for discrimination, right?
So let me ask you this then, and I thank you for your, being candid about your position, and please, forgive me if I gave you the wrong impression. I just wanted to find out from someone who's up on the front lines. I mean, you day in and day out, you're much close to it than the average person, and I think from this platform, I kind of want the information to go out so people can understand that, it's like police work. We get good and bad. We get good and bad days. But when those bad days get bad, there is no guarantee we're coming home, because once the lead is starting to be thrown because some knucklehead wants to shoot up a place, you really have to assess, but yet you don't have the time to assess the fact that, hey, I hope he just doesn't get a lucky shot and catches me, one of those things. So I think what I wanted to find out from you is being up on the front lines, being there. Especially you mentioned that some of your coworkers or workers in your profession have not been vaccinated. How real is it that they can get tagged by this virus? Because everything that we read and hear on the news, it seems like, and I said this last night, it's like a train wreck ready to happen. I mean, it's getting riper by the day. And I told Mel last night, I'm hoping and praying we can keep it on the rails and guide it into a safe area where, you know, it steers away, but it just doesn't look that way. It just doesn't look
Yeah.
that way.
You know, it's tough, right? Like I say, people make their own judgments, and you know, they have their strong beliefs on it too. And it's like, yeah, we could fight it and draw it out with management in the courts, but I don't think in the long run we would succeed in the courts as the Texas cases have shown, right? So I don't think that's the wiser way to do it. I think that you know, like I say, I don't work with COVID patients every day. We did a little bit in the last time around in the unit that I work with, but some of my colleagues do, some other nurses in there that I know. And I personally know some who have worked with COVID in the COVID units, and they don't want to get vaccinated. And yes, are they taking a chance? In my opinion, they are. But we're using the PPE they're getting in the COVID units there and elsewhere in the hospital. They're getting the proper PPE to be protected, and if you use it correctly. But yes, a mistake can happen. You can still get tagged by it. It can still happen. You can still get tagged by it. You know, and to set the public's concern, oh, I don't want a nurse that's not vaccinated to take care of me. Well, we're wearing all of that PPE. That PPE is not only protecting the nurse, but it's protecting anyone else from anything that you might transmit at all, right? Because it's all there. So that's why I don't think mandation is the way to go. There's a lot of controversy going on, and you know, it's so complicated. Our society is divided on it right now. There are people, I think in my estimation, it's a distinct minority that are the anti-vaccine, or this vaccine at least, but it's a distinct minority. They're there, right? And I don't believe in trampling over their rights. I agree with all the things of trying to incentivize people to be vaccinated, encouraging them, educating, all those sorts of things. I really do have difficulty when it comes down to mandating and forcing people to do things. I just do. Yeah, it does. And you know, working professionals, the healthcare professionals, we know how to wear the PPE properly and use it properly. Obviously, if someone has worked in COVID all this time and didn't get it, but you know, honestly, a lot of our nurses did get COVID. Some of them are back on the job, some are not. It's like there are a lot of nurses that did get it throughout this pandemic.
Yeah, I we've heard some of those stories every so often. They'll pop one on the news. I do not envy you in that position, but you know, I think in the public employee union, I think what I heard Randy Perra say tonight on the news, and the UPW boss, it's some Wahini Lini Ho or something like that. I can't remember her name. I don't know her, but Randy was frustrated because the government never communicated with the union. They never communicated. There was never an opportunity for the public employee unions to participate in the discussions of how this thing is going to roll out. In fact,
right,
they have set the date as August 16th.
Yeah, and that was real close. I saw that.
Yeah, it's not even long enough to get your second shot for those that will decide to get vaccinated to avoid the testing every week. So I think that's the problem. I mean, you know, we got to work together on this. We have to be able to communicate and share and negotiate what is the best for in the union's case for their employees, and for the government's case for everyone. And you know, that wasn't done. So that again, you know, creating this divide, that's this canyon that keeps growing, I think is what frustrates a lot of people. And it's unfortunate.
They came out very heavy-handed, right? You're going to do this, and unfortunately, that tends to be the way with management, whether it's government or private sector. Even HPHS is pretty heavy-handed that they put out too. They're like, oh, we're not going to do this, but well, it's in writing there. So we need to bargain with them on, it's known as effects bargaining on the accommodations and, the testing, that sort of thing, what you do instead of getting the vaccine. And I think there's room for it. Like, and we gave the signals to management. We told them straight out, it's like we not dumb. We see the handwriting on the wall. We know where this is going. We're here to talk about it. They announce it, and now we have to send letters that we demand to bargain, and then we'll set up the meetings to talk about it, and hopefully we can soften the blow somewhat on the mandates. I saw a quote from the Kauai mayor. It's like, he's like, well, it's not really a mandate the way they're enforcing the Kauai. It's like you get the vaccine or you get regularly tested. Mm-hmm. And I think that's a very reasonable approach. That's a very reasonable approach to it. And we've got some indication that that's what they'll do. But when you have that threat of your career will be ended, that's heavy-handed. And it's that, and I understand it's controversial. We've got people on both sides of it. I've got members, I got members on both sides of the telling me, oh, everybody should be vaccinated. Why are you supporting those? And it's like, why aren't you helping us, protecting us who don't want to get vaccinated? So I get it from both sides. No matter which way I go, people are not going to be happy with what we do, right? And we're trying our best to represent everybody in what we judge as the most fair way possible. And we're human. It's like, I hope we're making the right choices, and I hope we're able to soften the language in these so-called mandates somewhat. And I hope people actually go out there and get the damn vaccines. I'm sorry, but that's my personal belief that people should get vaccinated.
Yeah, I hope so. I know you bring up a really good point. The message, from the governor and from Mayor Blangiardi and from Mayor Roth and from the message was all the same. Take the vaccine or get tested. The governor, Blangiardi, and Roth was very heavy-handed. And then Derek came out, our Kauai mayor, and again, he as far as I'm concerned, we need to use Kauai as a model more often statewide. But he simply said, we're giving them an opportunity to opt in or opt out, right? That's exactly how he said it. You opt in, you take the vaccine, you opt in. If you don't, you opt out, and you just go get tested at one of our free testing clinics that is all over the island, and then you can come to work. But the message is the same, or the outcome is the same, but the messaging. I heard today that the governor say very clearly that if you choose to ignore it, that you could be terminated. Wow.
I heard the same thing, exactly. Wow. And that was my impression too. It's like, and I get it. I guess one school of thought is that we want to coerce people into getting vaccinated, right? To me, that's what it is. They're trying to coerce people into doing it. So we have to have this big threat behind it. And then, and we've got people on the side, oh, well, they're not going to follow through on the threat. Well, but if that's you and your job on the line, that's a kind of scary proposition, especially when it says when he said you can lose your job, or it says right in the policy, you can lose your job for not doing this. Yeah, I agree. I agree with you. I wish we would follow Kauai's lead more often. It seems a much more reasonable approach to me.
So let's fast forward now. We're at a position where if this virus does take off and we just don't have enough nurses, and we got sick people coming in, do you think that any of the major hospitals will kind of be creative and say open outside units to handle these? Well, I guess at this point it really doesn't matter, because you just won't have the personnel to take care of people, right? I mean, that's what it boils down to.
Right. It's more so the personnel than the beds. I mean, the beds are an issue too, because right now they have not, to my knowledge, They haven't stopped doing elective surgeries. So that, that's why my unit cannot. Originally, though, I was told by upper management that my unit tomorrow is going to convert to COVID. We're actually going to move and they're going to shuffle people around. They can't because our beds are all full with non-COVID patients. So, and it's because we're still doing elective surgeries and non-emergent emergent cases. They haven't cut it down like they did last time. I'm imagining if the numbers keep going, it's just a matter of time. They're going to have to. But their reluctance to do that is that's where the hospitals make their money, right? They don't make money caring for sick people. They make money doing elective surgeries.
So has the hospital, from your, being head of the union, have they ever said that we have this formula or this matrix that when it gets to this certain threshold, that's when the conversion starts? Or have they discussed anything in that sense?
Yes, but it's a very fluid matrix. It changes almost daily. It's like, here's what it is now, and then and I get it because the situation is changing daily. So as they go, they keep tweaking it, and it's never the same for very long, right? So this tweak that the unit that I happen to work on is going to go COVID. That's a tweak from last week. It wasn't. It was going to be a couple other units first, and then they said, and I listened to the rationale, and it makes sense that ours should be the next one. It does make sense. That's good rationale that they put out there. But their matrices, they do have these matrices. If we hit this number, then this next unit opens, and they set all of that in, but they constantly tweaking it. So it's hard to judge, and I think it needs to be constantly tweaked because it's a constantly fluid situation. So they do have it. I haven't heard. I've asked them, well, are you still doing the elective surgery? And they have not ever told me at what the trigger is that's going to make them stop doing those surgeries. So one thing, what they'll try to do is move a lot of things to the outpatient arena, where they do them in the surgery centers, that sort of thing. And so people don't stay over in the hospital. That way they can still keep doing. It's important. These are important treatments too, right? They're things that can generally be put off for a little while, but that was the problem before. They put them off, and then they all accumulate, and you get people getting sicker because this thing that could have had an intervention early on was postponed. So I appreciate their dilemma. It's like you'll hear me criticize administration and management a lot, but things I appreciate the dilemma in that they've to do all the balance out. Those things need to be done too. I think if the numbers are going up the way they are predicting, if it keeps going like that, and I think it's smart to be conservative and rather overestimate what the numbers will be than under. I think they're going to have to start reducing the amount of things and start trying to clear out the patients who are not, so that we can handle the COVID influx. And then all the other things, there are people that need to be hospitalized. It's not an elective thing that, heart attacks, strokes, car accidents, things like that, that's still going on. Those people still need care.
Right. Okay.
Yeah, I think, back in the first go around, remember we had lockdowns, we had stay at home. So we didn't have as many car accidents. We didn't have as many of these incidents that would require people to be taken to the hospital and admitted. That took a lot off of
that's true
load. And now everything's open. We have the car accidents. We're having a lot more incidents that require hospitalizations. My question is, as far as we're talking about nurses, but are you aware about the other support personnel, respiratory therapists, regular nurses, anyone else? Last night we had Dr. Miskovich on our show, and he was in Arizona, but he had gotten a call about one of his patients, I believe, was being routed to the hospital, and then there was a divert. There was he was diverted, and I believe he said it was Queens. I can't remember if it was Queens or Straub, but they're diverting the patients. His patient got diverted to Castle because they're diverting because we just don't have the resources. So that's not going to get any better as the cases rise. But where are we on the other positions, the other technicians and
through the same thing as the nurses. You know, it's like we represent some respiratory therapists and some nurses aides in the long-term facilities like that. Primarily we represent nurses, but we do represent some of the other categories of healthcare workers too. And they're going through the same thing as the nurses. The nurses aides are right there with us. And at Queens, they happen to be Teamsters, but they're experiencing the same thing as we are. The respiratory therapists are experiencing the same thing. So some of these, you know, they say nurses are coming that FEMA sending. They're sending the respiratory therapists too. It's not. Some of that number are respiratory therapists. I was told that today. The majority are nurses. In general, you know, hospitals staff with a lot fewer respiratory therapists than they do nurses. But I'd say that all of the healthcare fields are feeling the same crunch to different degrees. And you know, like even in, as you said, in nursing, not every nurse is dealing directly with the COVID patients, right? So primarily the ER sees them. They often come through the ER. So the emergency rooms get them a lot. And then you'll have your dedicated COVID units that get them primarily. And as I said, that's expanding at this time where more units are being converted over to being dedicated COVID units. So that, but even the nurses and the healthcare workers that aren't taking care of the COVID, the strain is on everybody. We're short as it is, so it's even more. So they try to funnel the need to where, you know, the help to where the need is greatest. And so that means everybody feels it. Everybody is hurt. It's like we've been running short, as I was saying before this flush. And running short means, you know, two things. Either you're going to be paying somebody overtime to do a double shift or picking up an extra shift, and so they're working tired, or you're going to be running short staffed and you have one fewer nurse. So that means everybody has to divvy up their load, and you pick up extra assignments and you cover more. And so what happens when you cover more? So, I mean, there's statistics, I can't quote exactly what they're at time, but there's the chances of dying rise with each extra patient the nurse has. Because, I mean, a nurse's primary thing, we do procedures and things like that, but our primary thing is observation of the patients, being able to see a change happen and taking the appropriate steps when that change happened, notifying the right people, doing the right orders, instigating the right orders. It's being able to see that this patient is something has changed and something's going on. And if you're stuck in a room with one patient, you're not that much less time you spend with the other patient, right? So if you spread yourself out even thinner, there's that much less eyes on the patient with your time right there with the patient, because that's when you see it, you need to react to it, right? So that is the biggest danger with the short staffing, in my view. You know, and that's why we push for staffing ratios big time. We push in all our contracts we do. We got a bill in the legislature on it. We didn't get it heard last time. We're hoping to get it heard this time around. We know it's going to be an uphill fight because the hospitals don't want to do it because it's expensive, and hospitals have deep pockets, and they can give contributions to the legislatures that we can't even come anywhere near. So, you know, we need to get a grassroots campaign going with the nurses and their families and the public support to demand that our legislature pass these kind of laws like California has. California has had it for over 10 years, probably closer to 15 years. And it's made a great difference there as far as it's not perfect. They got problems there too. They still get shorted. And I think their governor actually temporarily suspended the law when they were having in the worst of their COVID situation there. So it's not perfect. No place is perfect, but we really think it would go a long ways to improving the safety for the patients, the well-being of the nurses, psychologically and physically, to have staffing legislation, because the hospitals have shown us that they're not going to do it unless they're forced to do it. They're not going to do it on their own. You know, we would have to strike, and we'd all have to go, and it would be a big, painful thing to force them that way to do it, to get it within our contracts. It would be, so they've got to be forced to do it, and legislation is one way to force them to do it.
Whew. That is a lot to consider. you know, thinking, and as I said it before, you know, in 2012, I went under open heart surgery at Queens, and surprisingly, that night was that night in 2012 where there was a huge accident on Cunha. So I was not the only one in the ICU post surgery. You know, there's a lot of other people coming in, and I can just only imagine now, you know, who gets first dibs on what available beds are. Is it the COVID, or is it, you know, something else that happens? I guess, you know, someone makes that decision, right? Someone makes that decision. And
Yeah, it's triage, right?
Right.
It's a form of triage, and who gets it, and who gets the one-to-one care, which ICU patients ought to have in most cases, definitely COVID ones, because it takes so much more time with putting the gear off and on, and who has to, you know, we had a lot of our ICU patients were doing 2-to-1. That means the nurse would care 2 ICU COVID patients at the same time. That's not safe. That absolutely not safe. You know, I think you related your story before where the nurse stayed with you. Yeah, well, if they had another patient, they wouldn't have been able to do that, right?
Right.
Or they'd be neckling another patient if they did that.
So let me ask you one last thing. As far as a safety factor is concerned, I know the police department at one time they wanted officers to work extremely long hours because there's shortage of manpower. But then, you know, I know that the union got involved because, you know, the fact is when you have officers carrying weapons, and it's just that if they're wrong, something happens. You know, there's so much blame to go around. But does that hold true for nursing when you having them work just this humongous amount of hours that they can maybe possibly slip up? And I'm not trying to focus in on it. I'm just wondering how do you handle that, especially with these nurses having to work long hours?
Yeah, I mean, of course, they're human, right? It's like you get tired. You don't think. I know, you know, anytime that, and I used to work night shift, and I would stay and do a double shift, and you go from nights to days. By 10 o'clock in the morning, after I'd been working since 7 p.m. the previous night, I'm talking bubbles already, you know. And here I'm in charge of giving the patients medications. No, it's not an ideal situation. You don't want to have to do that, right? So that we've got in some of our contracts, like each one of the employers, it's a different contract that we've got with them, right? It's what we were able to bargain. And so some we have limits on the overtime to do. Yeah, we had, you know, we've got, it's a case that's going to arbitration soon where they were making nurses work 20-hour shifts. That's ridiculous. That wasn't in the hospital. That was for dialysis and dialysis clinics. And it was a while back, but it's only getting to arbitration now. Talk about not safe. Even 16 is verging on it already. You know, it's like, I know I've done it multiple times, and I tell you that we call it doing a double back. It's like you work 16, then you have 8 hours off, and you come back to work and do another 12. Right. Every time I would do that, I'd get sick. Physically, I would get next day I would have cold symptoms, kind of thing, because it runs you down. It's physically hard on your body to do that. You know, night shift in itself is physically hard. I worked nights for many years. I've been on days for a while now, but I worked night shift for many years, and it's physically hard on your body to do it. But in jobs like nursing, it's essential that you have people work night shifts. You have to do it, right? So when you put on top of that the doing doubles, you know, I talking to my friend in ICU after negotiations when she was on vacation, when she went back to ICU, she told me that her first day back, she did a double shift and then did another double shift the next time. So back-to-back double shifts. I'm like, that's insane. How can, you know, you're going to kill yourself doing that? And it's a sense of responsibility I think people have, that they don't want to leave the patients. They don't want to leave their comrades, their coworkers.
And that's where it's important that the managers, supervisors, you know, because you have those very energetic nurses. Same with the police department. When I was a sergeant, you had those guys that would volunteer to run the doubles, and because they love their job, and in this case they really care for their patients. But that manager or supervisor's got to step in and say, for your health and safety as well as the patients, you need to go home and get some rest. But if
Yes.
you don't have the backup people to backfill,
That's what I was going.
then you have no choice. And then these people are forced to work. And I'm so concerned about not just their physical health, but their mental health. The PTSD must be rampant right now in nurses because of what they see every day, especially these COVID nurses that are. And again,
It's real.
We talk about nurses, but this encompasses respiratory therapists. Even I see some people posting about environmental specialists or housekeepers. Everybody in that hospital is being traumatized by this pandemic, and I feel for all of them.
Yes.
And it's scary, and and the problem is that as we look at these numbers, we know one thing, Dan. We know that the numbers are going to rise. There is nothing that we are doing right now that's, even if all the government workers got vaccinated tomorrow, it's going to take a while to create this partial immunity. But the virus isn't stopping right now. The virus is continuing to spread as we speak. So we know for the next 2 weeks, 3 weeks, the numbers are going to rise. We'll be over 1,000 cases soon. Our hospitals will be filled up. And I'm not saying this will scare anybody. I'm just saying this is what's going to happen.
Yeah. What I find interesting, look at, the government saying, "Oh no, we're not going to do any shutdowns." We're almost, we're almost at where we were maxing before. We shut down then, and not that I'm advocating that we do shutdowns, but it does disturb me to go out and see people not wearing masks and congregating. And I understand why they're doing it. I get it. I'm tired of doing it too. But it's like people wanted to believe that it's all done and over with and we can all relax and go back to normal. But it's not done and over with. We still need to keep these precautions out there, and I'm with you. Vaccinate. It's like you should. I believe it. But regardless, even if you're vaccinated or you're not vaccinated, if you're going out in public, wear a mask. Even more so, wear a KN95. They're available now. It's like I get it, but wear something. Don't get too close up to people that you're not in your circle, not in your immediate family, right? Use the caution. I've heard of some hospitals on the island that were relaxing things because people were vaccinated. So this was reported to me that we're having meetings where everybody's taking their mask off in the same room because, we're all vaccinated. Well, you're not all family. You don't live in the same household. You can still be carrying the virus even if you're vaccinated. I mean, you give it to your person sitting next to you, and they go home and they give it to their little kid or something, right? It's like I was like, why are they relaxing at this point? When hopefully someday it does go down to just a low level, we can do that. I personally don't believe that it is, and I'm surprised that there isn't more push on that. It's like it's been a little while, but last time I went down to Waikiki a few weeks ago, take my son surfing out at canoes, and you don't see anybody wearing masks, and it's crowded, and nobody's wearing a mask out walking on the sidewalk and standing in lines to get into the restaurants. So, not to say that this is being caused by the tourists. I think I was in a meeting with other union leaders, and they said they had heard that it's primarily local people congregating, and a big part of it is local people coming home from Las Vegas. And that sounded like a reasonable assumption to me, that you would bring it in and spread it along your circle. Because how many of us have that close contact with the tourists, right? Especially right now, unless you're working there with them, and you're wearing a mask if you're working, I hope. we don't have that much close interaction, but we do with our families. So our family goes to mainland, catch them, come home. That's how it's going to spread in our communities, right?
Well, one thing that's kind of baffling in
That's
this.
re-
Uh-oh.
Oh, are you there,
Dan?
Dan? Hello, Dan. Oh no.
He just froze.
Well,
Well, he's with us. He's with us in spirit. I can see his picture right there, but he's.
yeah.
Hey Dan, I don't know if you can hear us. If you can hear us, you might have to exit and come back on because you're frozen on our screen.
Yes.
I hope this is not the start of the bam.
But you remember before they used to say, "Wow, lucky you live paradise. You live paradise. No need locked doors, right?"
Yeah.
But we say, we say we live in paradise, but you still got to lock doors.
Yeah.
Yeah. I guess they promote the fact that, hey, we vaccinated, and I think that's where a lot of the messaging gets skewed because they play on it so much. If it's unknowing that if someone says something and they're so convincing that it will convince you to think, hey, you don't have to worry. No, you still have to worry. I mean, that's what's called erring on the side of caution. You can't be cautionless, So I hope he comes back. I mean, was
I
was
hope
it?
so.
Yeah.
I hope so. And he's on Zoom. He's not on Facebook, so Facebook cannot boot him.
Yeah.
And Zoom is not gonna boot him. I'm not sure what happened. I think it's his internet. But I just want to say that this morning I watched the governor's press conference, and he was on there with had our mayor and Mayor Roth and Mayor Blangiardi, and then this afternoon had the Senate COVID committee. But what's very apparent is that they have put all their eggs in one basket, and that basket of eggs is the vaccination basket. That's it. Now there is some speculation that tomorrow the governor is going to announce restricting gatherings. 25 outdoors, 10 indoors. That is yet to be seen. That was what was talked about today. They're going to have a meeting tomorrow morning with the governor and the mayors only, and General Hara to discuss that. But all the discussion today was about the vaccination. We're going to force people to get vaccinated. Whatever. I'm not going to be here to debate one way or the other. But there was no talk about anything else. There was no talk about, in fact, when the Senate committee talked about the possible travel restrictions, it was very clear that they're not exploring that right now. In fact, they don't believe it's an issue. It's terrible because it is an issue. I showed you our Kauai numbers today. 63% of the cases today were travel related. Again, not tourist related, travel related. And this virus is spreading. The numbers are increasing right now. I did want to, for those of you that don't know, David Lacock from Haena, Kauai boy, passed away today with COVID. Didn't show up on the report today because today's numbers that you saw was Tuesday's numbers. So we're 2 days behind, but that will probably report it in the next day or two. But my point of bringing that up, and I bring it up only because it's on Facebook. He's an artist. He's a good guy, and he's no longer here because of COVID. This is not going to slow down, and there is actually really no. Here comes Dan again. There was no, for me anyway, what I got, and if any of you disagree that actually watched it, and I know Dan, it sounds like Dan was watching it, but if any of you on there disagree, let me know in the comments. But I didn't see any, there we go. I didn't see any real strong concern or push to limit any activities, concerts, or travel. That was not even in the discussion. It is strictly vaccinate. And I think vaccination right now, in and of itself, is not going to be enough to isolate this virus because it's running rampant, and vaccinated people can pass the virus. So anyway, please tonight, before you put your head on the pillow, Pray for our nurses and our hospital staffs, as well as Mr. Lecoq, David. Rest in peace, David. Man, condolences to the family. Yeah, sad. It was sad. Yes, honey, he was getting better, and then just that's what happens with COVID, right? You get sick, and then you get better, and then it just comes right back with a vengeance, and a lot of people don't make it, and so condolences to the family. Sorry, Dan, we lost you for a little bit.
Yeah, it was weird. It couldn't get back on with I was using my iPhone, right? Because it has a better camera than a laptop, as you can see. But I was able to get back on with my laptop, but not the phone. So, I don't know.
No, it's
Spam,
just
spam.
yeah. They're spamming the phones now.
I guess that's something.
Well, Dan, man, I was another quick hour, man. I just want to say, I will let you, Oi, Charlie left now. Oh boy.
No. I'm okay. I'm gonna get something.
Okay.
I'll be right back.
Okay. All right. I thought they was taking us out one by one. I was gonna get ready to let's go. Dan, again, we appreciate you. We appreciate what you're doing. We appreciate all the nurses and all the different staff that runs that hospitals and takes care of us and our patients. Any closing thoughts for our viewers? And again, you got a lot of people, a lot of nurses, a lot of hospital people on the call.
Thanks, Mel. I want to just, thank you and Charlie for providing this forum. I think it's really good for people to be able to speak freely and to hear each other. And it's a real good service you're doing for the community, doing these forums. As far as our thing, it's like, yeah, please, be careful out there, wear your mask, make your own decisions. I highly encourage you to get vaccinated if you're not already, but whether you're vaccinated or not, take your precautions, wear a mask when you're out. Don't go to it's like I had an ER nurse ask me, tell them, don't go to the ER to get tested for COVID. The ERs are busy. If you're feeling a little bit sick, call your doctor, go to a clinic, get tested for COVID. Don't go to the emergency room. If you can't breathe, go to the emergency room, right? But if it's other than that, if you're feeling a little sick, if you think it might be COVID, you make an appointment, go to urgent care or something like that and get tested, because they're busy and they're busy saving lives, and it just takes them away from that service. So I ask members of the public to please be aware of that. And hang in there. We're going to get through this together.
Right on.
Awesome. Charles.
Well, I just wanted to be fair. I just wanted to be fair to everybody, okay? But I'm here, but I'll keep this next to me in case they take us off because of spam. But anyway, I'd like to say thank you to our wonderful guests as always. Thank you very much, Dan. Coming on and just giving a real comprehensive insight of what frontline heroes, in my opinion, my humble opinion, have to face with day in and day out. And so, ladies and gentlemen who joined us tonight, there's this topic that we're all sick of, and I wish it would go away already. I'll be the first one to say that, because yes, we all would like to return to some sense of normalcy, but just right now we can't. And as frustrating as it may be, we just gotta suck it up, and we just gotta keep on fighting through this thing, because I'm hoping and praying that we all live a good long life. But if we take this virus, we take it lightly and it tags us, then the question becomes, do you think you have enough gusto within you to outrun it? And many people right now doesn't seem to have that this is like a marathon. This is not a sprint. This is like a marathon, and you got to be able to run the entire lane. And how do you do that? You stay far away from this thing and just use caution whenever you can. Okay? So with that said, again, thank you to our esteemed guests. Thank you very much for all the information you shared with us tonight. To you, Mel.
Thank you, Charlie. Hey, Charlie,
yep.
Go get the low sodium spam. Get the low sodium spam. That stuff there is poison, man.
Brother, if I don't get spam, I give them with the spam.
And just
Dan,
let me show you.
Huh?
Put 20 show you.
Yeah, yeah. It's like going to McDonald's, get the Big Mac and a Diet Coke.
Yeah.
Hey guys, Dan, thank you very much, man. We love you. We love your
Yeah.
organization. We love your nurses. I mean, I think a lot of times these guys go unrecognized, and people talk about it, blah blah blah. But honestly, from all of us, all our viewers, thank you. We pray for you guys every single day. For our viewers, listen. You guys ever heard of a personal lockdown? Do you really need the governor to tell you you got a lockdown? Do you really need the governor or the lieutenant governor to tell you not to go to crowds? Do we need a law telling us gatherings are illegal? Absolutely not. Personal responsibility, folks. I have given up. I honestly, after today, I will be honest, I felt deflated. I watched, and I know, Dan, I know you saw the press conference, and I know you saw the Senate COVID committee hearing. I was deflated, man. I was like, golly, it's just, we are not making any headway. This is a train that's out of control. Then I thought about it. I said, I don't need them to tell me not to go to a concert with 1,000 people. They don't have to make that illegal. It would be nice if they did. But being that they don't care, we got to take it upon ourselves, personal responsibility. Stay away from people. Wear your mask. Wash your hands. Keep your family safe. Until we get through this crisis, we individually got to do what we have to do to protect ourselves and our families.
Right.
Yeah. I mean, seriously, if you think about it, right? Just don't do what you want them to tell us not to do on our own, and we'll be okay. This thing is going to come to pass soon. I can tell you, this is just my own unscientific, non-medical opinion, is that in a couple of weeks, this is going to blow up to a point where they're going to have to take action. Unfortunately, in that period, people are going to get sick and people are going to die. But that's on them. So we can do what we got to do ourselves to protect ourselves and our families. And I ask each and every one of you to do that. Again, thanks, Dan. Thank you, Charlie. Tomorrow night, guys, I have a call in to Mayor Harry Kim. And we're going to confirm that up in the morning, but hopefully we can get him on tomorrow night and talk story. It's always fun and entertaining. And we just hope you guys all stay safe tonight. Folks, we love you guys. You guys stay safe. God bless. Go eat your spam. And guess what? We made it through the whole video without a spam interruption. Could it be because we blocked the spam accuser? All right, guys, you guys take care. Stay safe.